Hi, my name is Dr. Arijit Banerjee, and in the occasion of World Autism Awareness Day, in this video I will talk about what is autism, its early super important diagnostic symptoms and treatment options of autism till now we have. So, autism or Autism Spectrum Disorder or ASD refers to a broad range of neuro-developmental disorder characterized by challenges with social skills, repetitive behaviors, speech and non-verbal communication. Asperger's syndrome, which was formerly classified as a separate entity, now grouped in the category of Autism Spectrum Disorder or ASD. Signs of autism usually appears by the age of 2 or 3. Some associated developmental delays can appear even earlier, and often it can be diagnosed as early as 18 months. A child with ASD has a hard time interacting with other problems. Problems with social skills are some of the most common signs. They might want to have close relationships but not know how to do it. Signs of autism in young children may include not responding to their names, avoiding eye contact, not smiling when you smile, not talking as much as other children, repeating the same phrase or repeating body gestures, etc. About 40% of kids with autism or autism spectrum disorders have communication problems like delayed speech and language skills, flat or robotic speaking of voice, and in some advanced cases, no communication at all. So when we talk about the cause, we have to remember that the exact cause of ASD is still unknown. The most current research demonstrates that there is no single cause, but scientifically it has proven that about 10% of kids with ASD have a form of genetic disorders such as Down syndrome and Fragile X syndrome. Research shows that early diagnosis and interventions such as during preschool or before are more likely to have major positive effects on symptoms and later skills, because there can be overlap of symptoms between ASD and other disorders such as Attention Deficit Hyperactivity Disorder ADHD. It's important that the treatment focus on a person's specific needs rather than diagnostic levels. Treatments involve combining more than one approach like behavioral, developmental, educational, and social rehabilitation or social relationship have proven more effective than working in a single way. We have to remember that autism is not an illness. Autistic people can live a full life. Autism is a spectrum. This means everybody with autism is different. Some autistic people may need little or no support, others may need help in form of parents or other caregivers in their every day-to-day practice. So if you have observed any of the symptoms in your child, it's essential to consult your doctor as early as possible. One thing I want to especially emphasize that parents should take their autistic child along with them for everybody's or every day's activity. It's if your child's behavior is unpredictable, you may feel like it's easier not to expose them to certain situations. But when you take them on everyday's activities such as shopping or going outside for social gathering, it may help them used to the world around them. Please don't scold them and focus on the positive aspect. Just like anyone else, children with autistic problem or autism spectrum disorder often respond well to positive reinforcement.